often is, isn't it? You can put closer, but not maybe not too close. Maybe just one step. That's it. I reckon that does this.
You let us know when you're good to go, guys. Yvette Darth, Minister for Health and Ambulance Services.
Interesting, yeah, we're actually okay. And then
I thought these were a bit high.
Thanks, Minister. Cheers.
All good? Great. Well, it's wonderful to be here today at the Orion Hotel with Minister Enoch and, of course, local member Cherise Mullen and Doug Marr, the owner here of the hotel, and we are celebrating the launch of the Queensland Check-In app. This is going to make contact tracing far quicker and easier for Queensland Health, which means that if we were to get local transmission of COVID in our community, we can identify, we can trace and we can contain COVID-19. We know this has been a really important tool for us to use throughout the COVID-19 pandemic. And Queenslanders have done such a fantastic job checking in and registering when they go to their hospitality venues. But with this new app that the Queensland Government have created and launched, it means things are about to get a whole lot easier. They'll be able to very quickly download the app, and that app will contain their contact details, so they will not, forevermore, have to constantly keep putting their contact details in every time they go to a venue if the venue has signed up to this check-in app. And I've just been talking to Doug, and he's been telling us about the amazing success here. Over 1,000 people checked in yesterday alone. So this is really important. I'll let Minister Enoch talk about just the security around data, but people can have absolute confidence that your data is secure. Importantly, we are collecting the least amount of information and only the information we need in relation to contact tracing. There's some apps out there that are asking a lot more than you actually need under the Health Directive. Ours only collects the information that is absolutely essential, and of course we're only keeping it for 30 to 56 days. It's also great today to say there's no new cases of COVID in Queensland. We have 11 active cases, and we've had 5,238 tests in the last 24 hours. We've also had 2,030 Queenslanders now vaccinated. We set ourselves a target of 2,000 vaccines by the end of our first week, and we've hit 2,030. And of course, we've got our other 3 hubs going online this week: the RBWH, the Townsville University Hospital, and also the Sunshine Coast University Hospital. I'll now pass to Minister Enoch to just talk a bit more about this app.
Thanks so much, Yvette, and of course absolutely a pleasure to be here with the Minister for Health and the local member Cherise, and of course the manager here at the Orion Hotel in Springfield. But of course most Queenslanders will know that local Queensland businesses across the state are back in business, and as we continue to implement our economic recovery plan. And of course this new Check-In Queensland app is the next tool in being able to support that economic recovery plan here in Queensland. This tool, this app, has been designed in conjunction or in partnership with the ACT government, who has also provided that solution to other states across the country. And it is an easy-to-use app. And as the Minister said, you download the app from your app store, you put in your information once, and if you attend businesses that have registered, then you would simply check in, and that would be the only thing that you'd need to do. So putting your information in once and then being able to check in various locations will absolutely increase productivity for small businesses, and of course make it much easier for customers across Queensland. And of course this has taken some extensive trials over the last few months from venues here around Springfield and Ipswich through to Cairns and other locations across Queensland as we tested this ACT solution for a Queensland environment. What we've seen already is now around 206. I think actually I just got told an extra business just registered this morning, so 207 businesses have already registered during the trial period. And we've seen some more than 38,000 check-ins during that time. In fact, right here at the Orion Hotel, we've seen some almost 7,500 check-ins during that period. And of course, that's been a massive success, and I'll leave it for Doug to talk a little bit about what that's meant for his business. But as I said, it is a very easy-to-use app. Businesses would simply need to register, and they will be sent a pack to be able to download the appropriate information and the tools that they need to be able to provide this offering to customers. And of course then Queenslanders would need to only just download the app and fill their information in once only. On top of that, of course, the data that many of us have been providing through lots of different apps that are being used all over the place, that data through this app, through the Check in Queensland app, will be held securely by the Queensland Government and deleted after 56 days. And as the Minister said, this makes contact tracing so much easier if there were to be an outbreak somewhere in our state. It will be optional for businesses, so not mandatory. However, I imagine that, like many other Queenslanders, the idea of only being able to, only having to put your information in once and then use this particular QR code at locations will be something that will be quite desirable, and I imagine lots of businesses will be quite interested in that. And I know that there are many more that are interested right now with their registrations piling in. And of course, if customers don't have a smartphone, there is another option that businesses are able to use. We've been able to work with the ACT government to ensure alternative methods if that's required. And of course, like I said, it's very, very easy. So download the Check in Queensland app. Make sure that you follow all of the instructions. It's so easy. If you download the Check in Queensland app, it'll be easier to check out Queensland businesses in your local area. And I'll hand over to Charisse.
Thank you and good morning. Welcome to Springfield and to the Orion Hotel, which is one of our most popular venues here in the region. There's not a day that goes by that people haven't stopped me in the street saying, you know, Charisse, it'd be great if there was just one app that you could download and have all your details in and then make it easy to get into various venues, whether it's a club, a hotel, a cafe, and here it is. The Check in Queensland app is here. I'm going to certainly be encouraging every business in my electorate to be part of this, and from speaking with Doug, we know that there is incredible benefits in having it. Hospitality has had a really rough time in the last year, and anything that we can do as a government to make it easier for them and for their customers to access these venues is really important. I know they had a lineup last night that goes around the corner. Getting all of those punters in very quickly is really important, and I'm just so grateful to our government for moving very quickly on this app. Thank you. Doug?
Morning. Thank you, Ministers. Thank you, Member. Look, on behalf of the Orion Hotel, I'm really proud to have been part of this trial. This started about 10 days ago in communications with the government and then Office on Liquor and Gaming. We took it over the first 4 days and communicated heavily with OLGR in relation to any faults and trials that we found. We've continued on for the last 10 days, and as the Minister said, we've had over 7,500 check-ins over the last 10 days. Just on 1,000 check-ins yesterday alone through our venue. Once you tell people it's a once-only event, has taken away what was previously happening where people would say, oh, can you just check me in? My phone doesn't work, my Android phone doesn't work. Now they know it's a once-only. They can enter their family, their friends as favourites, and then they basically make sure the camera's aligned to the app. Next time you check in, open the app, put the camera on, scan it, and you're checked in automatically. We checked in, as I said, over 1,000 or just on 1,000 people yesterday, and once they did it, we had people coming and going. Our members and our local patrons, I suppose, are absolutely ecstatic that they can just walk in, scan it, walk through. It's just a way of life now. They don't have to stand there and edit it. So it's been wonderful. The fact that we don't have to have staff on iPads, we don't have staff on doing Excel spreadsheets for the government now, and we don't retain their data, it goes directly to the government, is a big plus security-wise. It's a big plus and takes a lot of the questions away from our patrons or people who are reluctant to give us their details. It's now going to the government. So it's made it very more efficient. I've been able to take a staff member from the front door and put them back into a service role. So again, we become more efficient in our business. So I can't but ask every other business, go on, sign up, register your business, get the QR code and make sure that your patrons want to be in your shop. Thank you very much. Sure.
Obviously, I can hear you saving money in terms of not placing your person on the front door, but also in terms of no longer having to pay a third party to store all those details or use their software. Does that save you money there? Other businesses have to do that to save money for use software instead?
Absolutely. So the whole process with the Check-in Queensland app is more efficient, more cost effective and better for our patrons and better for our staff.
Does it cost you money to run it as a business?
Not now, no. It's free. It's a free app. It's a free app. You download it, you carry it on your phone. It's a convoluted system that we had. We had Excel spreadsheets. We were having to then electronically send them to Queensland Health. We had to retain the data for 28 to 56 days on premise. We then had QR codes, which you were sent different codes where the information was onerous. Not just name, address and email. It was, a whole range of others. You couldn't check people in with that. So if you came with a family and they had iPhones and some people had Android, we had to actually register every single person, so you had to put every single person's data in time and time again. So if you came in and then left, you had to re-register again. Whereas now if you come in, scan it once, you're done. So that time consuming and the cost, I don't know what it was in dollars, but all I know is I'm thankful for this app.
You say hundreds of dollars?
Go into the thousands, yeah, hundreds. Oh, it's brilliant. We're running a business. COVID's been hard on hospitality. The airlines and hospitality have been two of the biggest industries that have been affected. With the last 3-day shutdown, we're 3 weeks post that, we're just starting to get back to where people are feeling comfortable to come out in public again. So every time we shut down, we know it's for the best, but for us to open, it takes us 2 or 3 weeks lag time before we get back to some sort of full patronage. So if this is going to help, then I'm all for it from a business perspective. Mate, you come and check it out. I'll get you one really special. Thank you.
We're a year into the pandemic now, and it's been months since businesses have had to have an electronic check-in system. Why is this only rolling out now?
Look, it's important that we had a look at what was available out there and whether there was sufficient product already out there for the industry to not necessitate the government to step into this space. But what became pretty clear is that the products that were out there were not delivering on what the public want. And the public wanted something where you only had to put it in once and not keep continually repeating, putting that information in at every venue you go to. And I know some do capture data and retain it, but there are also a lot of QR codes that are collecting data that isn't necessary and certainly not being asked by the Q Health Directive. So they've looked at other states, and Minister Enoch's department's been looking at what is available, so we're not starting from scratch, we're not creating something brand new, what products are out there, and we looked at what the ACTs are using, and we've been able to build on that. And that cooperation between jurisdictions has really helped us as well, but we've also been trialling it. It's really important we trialled this and make sure we get it right, so that the community can have confidence in using the app and the QR code. I might get Minister Enoch to talk about that, but it is about making sure that it does work with our system. So just the ACTU's computer network and data system is not the same as the Queensland government system. So at the very least we have to adapt it to make sure it works for our data retention system here in Queensland, that we've got all the safety measures and security around people's data that we need and we want here in the state. I think, we've heard it from Doug, businesses will flock to this, but I think customers will drive it. Because every customer that downloads this app will walk into a venue and go, have you got the government QR code? If not, why not? So I think the customers will very much drive this as well, because they'll be looking for that really easy way of walking in and scanning their information. And as we've heard, it's free and it's secure.
During those trials, how did the integrity of security
Okay, so I'll just let Minister Enoch talk about that.
Yeah, thanks very much for that question. And of course, there's been some rigorous trialling and piloting around the whole of the app, and it's stacked up every time. So the fact that we've been able to utilise the work that ACT had already been doing in this space gave us a chance to sort of fast track our systems standing up around it. Of course, you need to be able to retrofit it for our systems and of course our directives here in Queensland. And we've taken the time to make sure that it stacks up in Queensland, and certainly from the advice that I've been given by the department and through those organisations that have been trialling it and piloting for us, it seems to have stacked up. So that's why today being able to launch Check in Queensland is a real coup for our state and for businesses like Orion Hotel and others across Queensland, where customers can easily and readily engage, be there, spend money in their local businesses and feel safe at the same time.
Talk about security around data. Where are you holding the data? Queensland government is here on Queensland soil?
Yeah, that's right, absolutely. So we hold our own data here, and that's where it's being held with regards to this important information that will be only utilised and accessed by Queensland Health, particularly in an event of an outbreak.
Just from a your perspective, with all these other apps that have been collecting third-party information, have you had any reports of being misused by companies or third parties to scamming people?
Yeah. There's not been any direct reports to me with regards to those concerns, but I know that many Queenslanders, including myself, every time you fill in another one of those apps, you wonder where your information is going. Now, of course, Queenslanders will have the option to utilise the Check in Queensland app, knowing that it will be securely held via the Queensland Government and only utilised by the Queensland Health Department in the case of a breakout.
As I say, we set ourselves a target of 2,000 in the first week. I would expect that we're going to at least get to 3,000. We're doing this slowly, so when a new site, a new hub comes online, they'll start quite slow in the first few days, just so the staff, who have been amazing, who have all gone through multiple simulation procedures and role-playing to make sure, of course, they can't practice with the real thing because we don't want to waste the real thing, but they have certainly done simulations and practiced the procedure right from when it arrives in its trays to go into the freezers, right through to defrosting, diluting, actually getting it out of the syringes so we can get 6 vaccines out of each syringe, out of each vial, and then administering it, and of course monitoring people for 15 minutes afterwards. So they've gone through the whole procedure, but they'll roll that out very slowly. So the RBWH is commencing tomorrow, and we'll have Sunshine Coast and Townsville coming on near the end of the week. So I hope we can get through to that 3,000. Of course, we will ramp up to the tens of thousands once we've got the AstraZeneca, but it all depends on the volume that we receive. There's no point setting ourselves a target if we don't actually have this vaccine arrived and actually distributed out to our relevant hubs, or when AstraZeneca starts, out to the relevant facilities that would be administering it. So I'm cautious about predicting numbers as we go forward, But I have no doubt once we've got AstraZeneca in large numbers, we'll be able to be vaccinating tens of thousands of people a week.
And it sounds like, from what we've heard about the first training program being an online module compared to what Queensland is doing, have the vets told you exactly what their training is after that incident this week? And would you like to see them do something more like Queensland's training module to make sure that no mistakes?
Yeah. So the Commonwealth have been communicating with all of the health ministers in our departments across the country since that incident occurred to tell us what they're putting in place to give us the assurance and give, most importantly, the public the assurance this vaccine is being rolled out safely in our aged care facilities. I know they are very, very alert to the fact that that confidence has to be maintained and they have to make sure there's the highest standard of safety and training around this. I do believe, and we're raising this with the Commonwealth, and my department has raised this with the Commonwealth health officers, that there should be an external assurance mechanism. We have done it right across Queensland Health. We have got an external assessment and assurance process that has come over the top, have assessed our training and has assessed our processes from end to end to make sure that everything is put in place to identify any issues as we go along. So we've had that external scrutiny, we've got the tick of approval, and I think it would be a good thing for the Commonwealth to have some external assurance happening over the top of the contractors who have been contracted with the Commonwealth Government to roll out the vaccine in aged care. And of course when we go through the next steps of the much broader rollout.
Do you know if the vets have still been administering the vaccine in aged care homes in Queensland?
Yes. Yes, so contractors have still been administering the vaccine. In relation to Healthcare Australia, as you're aware, the Commonwealth has gone in and done assessment and audits of them and asked for particular information to give them confidence that they're doing it right. We have also issued them a show cause because we are the regulator of them, just to make sure that they've put all the practices in place that are necessary to give us the confidence. But we do have the overall power of these regulators, that if, as regulators of these contractors, if we believe the contractors are not fulfilling their regulatory obligations in relation to this vaccine, we absolutely will step in and take action.
And were you surprised that the doctor that gave the jab already had, he had restrictions on his registration in terms of prescribing other medications?
Look, I am aware, I want to be careful about talking about the individual doctor. I'm aware of some factors around that. Again, as I understand, those factors were not relevant to whether his suitability to administer the vaccine. My biggest concern was that he hadn't undertaken the training and that there wasn't proper safety measures in place to identify that before he walked into an aged care facility and started administering the vaccine. But I know that the Commonwealth are very alert to this fact and are taking action to ensure that every person who walks into an aged care, and I can say that anyone who walks into a state-owned and run residential aged care centre, we are ourselves putting an extra layer of oversight now to ensure that all practices are followed in line with our expectations. So we have observers going into every one of our state aged care facilities now to observe the administering of this vaccine.
And with the show cause, have you had much of a response to that at this stage? Are you personally confident about the way this is being rolled out in Australia?
Look, I have confidence that this vaccine is working. It is going to be rolled out safely and effectively across Queensland. But, as I say, we won't hesitate to step in and take action if we believe that there is behaviour that doesn't meet our expectations, because we need the public to have confidence. We want the public to have confidence and we want this to be done safely. We have I know Dr Young says she wants to vaccinate 5 million Queenslanders, ultimately, if it can be administered to children, that's where we want to get. But at the very least, there's 4 million adults out there in Queensland. We want every one of them to come forward and get vaccinated, and we will work with the Commonwealth and other states and territories to do everything possible to make sure this is done safely and to give them all the confidence to step up and get that jab when their time comes. Mm-hmm.
Currently, according to report today, the former Treasurer on April 1 last year signed up at a Board of Treasurers meeting to pay for hotel quarantine. Is that correct? How does that accord with what the Deputy Premier is doing now, saying Queensland?
Look, I have not seen any documents or records that say that the state government signed up to footing the bill for other jurisdictions. Queensland has not asked any other state or territory to pay the bills of their residents who have come here, and we've asked of them to go into hotel quarantine. As we know, there was a period of time last year that we were fully incurring all the costs in hotel quarantine, and then we got to a point that we asked for individuals who were staying in hotel quarantine to pay a certain amount as part of those costs to take the pressure off taxpayers, and we thought that was a fair and reasonable balance, and it was agreement from National Cabinet to do that. The fact is, every jurisdiction has incurred significant costs in setting up and managing hotel quarantine. The onus on that, the bulk of the people we've managed, have come from overseas. I believe it's the Commonwealth who should be stepping up and assisting us financially. I'm not going to start having a fight and playing tit for tat with other jurisdictions. I don't think we should be cannibalising each other. I won't be sending a $30 million invoice to another jurisdiction, especially when it includes thousands of people who actually don't have a residential address in Queensland. Why would we hand over taxpayers' money for people who don't identify as having a residence in Queensland in the first place? So, no. We're not going to do that, and I believe that if there's a conversation to be had about the significant cost that every jurisdiction's incurred on hotel quarantine, it should be with the Commonwealth. I think the feds should financially contribute to hotel quarantine. We are taking people who have been approved by the Commonwealth to arrive in each state and territory, including repatriated Australians. We have incurred significant cost in doing that. We understand the necessity to do that. We have done our part, but in fact we're doing all of it, not just our part, we're doing all of it. So it would be good to see the Commonwealth financially contribute to hotel quarantine.
In what way do you have to feel?
Oh, anything would be good, but yeah, I'll take 50-50. Look, honestly, there just needs to be a genuine dialogue with all of states and territories, with the Commonwealth, of what financial assistance they can give, because we are going to have to keep maintaining hotel quarantine for some period of time until we have the large amount of the Australian population vaccinated.
And you said you haven't seen any documents or records of agreement made. But is your understanding that there was a verbal agreement made?
No, that's not my understanding at all. I have no information whatsoever that verifies that that conversation or agreement was reached.
In regards to that show cause notice, can you tell us how long Healthcare Australia has to basically start up and show their
I believe they had, as a matter of days, it was less than a week to give the show cause and to respond. I would have to check with the Director General. I believe they've probably got at least till Monday to respond, so I'll have to check. But we take this very seriously. I want to make sure that every single person with any contractor who's walking into any facility, private or public, in Queensland, have undertaken the adequate training.
And just in regards to those observers, are they only going to state-based?
They're only going into state. We don't have any legal authority to walk into a private aged care facility. That is the responsibility of the Commonwealth, but we have suggested to the Commonwealth that they look at having an external assurance process over the top of what they're doing.
Just to double check, is it the Commonwealth, through their contractors, that are vaccinating people in state-run aged care?
Yes, so it was agreement with all the states and territories as part of our implementation plans that the Commonwealth would administer the vaccine in all residential aged care and disability facilities, both public and private, because about 97% are private, with 3% being public. But we want to make sure that if they are public facilities, that we have the oversight that we know we can put in place. So.
I did have a question about the Olympics.
Yes.
Just the procurement policy in terms of businesses getting the first party material. What strategy is being worked on and what confidence can businesses have?
So we showed during the Commonwealth Games that Queensland can do procurement very well and support local businesses across this state. And particularly around that supply chain. So it's not just big businesses, it's small to medium businesses benefiting from that supply chain. And in fact, $1.7 billion, over 82% of all contracts in the Commonwealth Games went to Queensland businesses. So we've shown we can do it. We've shown through COVID that we all need to step up and support local businesses in Queensland, and we've seen local business step up and innovate. And we're hearing from Doug. He stepped in late last year, coming into hospitality in Queensland during COVID is just a huge decision, a huge gamble, and it's paying off for Doug. And we want to make sure we're supporting businesses like Doug through that process. So we will continue to have a really strong procurement process. There is significant opportunities for Queensland businesses if the Commonwealth Games, if the Olympic Games comes to Queensland, and we certainly hope it will.
Can I just throw one more on behalf of this company?
Yeah.
So it's free to download from the user, but is there any infrastructure cost for businesses?
So this is a free app. It's free to businesses. They just need to register their interest and they'll be sent a registration pack which will include all the information that they need to be able to get started. So it's free to businesses and free to consumers.
For the businesses who have already invested in a third-party option, at the direction of the state government, can you understand why there would be frustration that now there is a free option that they didn't have earlier? And also just one more thing to do for an industry that's already been disrupted.
Yeah, well, obviously we've not made it mandatory, so those businesses who elect to continue using their particular apps are free to do so. Of course, this is another option now that's been made available as a result of some conversations that the Premier had at the federal level, and today we get to launch this app to be able to support local businesses and, of course, support consumers to back them in.
Still a gap because we saw the Premier come out quite angrily and the Glen Hotel wasn't recording patrons' names and no doubt with plenty of other venues that weren't doing that.
Yeah, well, certainly there was a directive that was made when we had that particular outbreak, and Minister for Health might want to make further comment about that. And of course, electronically we get more, eligible. You can actually read the information. It makes it easier for contact tracers, and that's why this app in particular is one that I think many businesses will see as an opportunity, and of course consumers will see it as an easy way to be able to support local businesses.
And I just want to double check in terms of access to the data. So it's can only be accessed by Queensland Health in the event of an outbreak.
Yeah, so that information, the data that's collected, is stored for up to 56 days and then deleted within that period. And only used, of course, if there's contact tracing required. So Queensland Health will be able to access that information immediately if they need to be able to carry out contact tracing, which of course is an incredibly important tool when it comes to locking down any potential breakout. And of course, it continues to be an important tool in our economic recovery plan so that we can keep businesses open and going, and we keep our economy going.
I've got a question for the Health Minister, the federal government is announcing a new task force to combat COVID-19 misinformation. What are your thoughts on that?
Anything we can do to address misinformation out there in the community about the vaccine is important, and I know the Commonwealth and states and territories have been working together about our communication strategy We want to make sure that people have as much information as we can provide to them to give them the confidence this vaccine is safe. You can go onto the Therapeutic Goods Administration site, you can look at how this went through an assessment process, the criteria, how it was approved. Of course, the Commonwealth and the state COVID websites also tell you how this vaccine was approved and who it's safe for and who it isn't. Please do not take advice from anyone who is not a medical professional, and it's not a government website or the TGA website about who can or can't take this or get this vaccine. Please make sure you are looking at a trusted source. If you're not sure, talk to your doctor or a pharmacist, but go to a trusted source. Do not look at this rubbish on social media, and I will speak up at every opportunity I can, that these people who are putting fear out there in community about this vaccine, they are causing more harm than good, they are risking people's lives, and they are going to damage our economy if they get what they want, which is convincing people not to get vaccinated. It is not like the mumps or measles where we can just comfortably rely on everyone else to get vaccinated and then we'll be safe. No. If you want to make sure you're not sick and you don't end up in ICU, then you have to get vaccinated. That's the way this vaccine works. Take responsibility for your own action, get vaccinated, and make sure that you're playing your part in keeping Queensland safe.
Thank you.